Very good evening to you all. Sri Kumaraswamy Mahavidyalaya Avsa, District Latur in Maharashtra State is organized an international e-conference. So first of all, I welcome today's keynote speaker for the session, Honorable Cheryl Field ma'am, and also welcome the chief organizer of the series, our ideal principal, and welcome to all dear participants. The topic for today's presentation is Empower Caregivers and Empower Care. Now this topic is going to present, as I have mentioned, today's keynote speaker, Cheryl Field ma'am.
Thank you, sir.
She is from New Hampshire, United States. Now this is a very brief introduction about the keynote speaker. Now, with this brief introduction, now I request you, madam, please start your presentation on today's topic, Empower Caregivers, Empower Care. You are most welcome.
Thank you so much. Good morning and good evening. Good morning to those of you in the Eastern time zone and good evening to those of you in India Standard Time. It's a pleasure to be here this morning and to talk about a concept that's really universal to humans all across the globe, as so many of us as humans find at a time in our life that we require care. And many of you very suddenly become caregivers. And maybe you don't even have the education in medicine or health like I do, but you find yourself in this role of caring for someone else. By means of introducing myself, in the United States, I am a registered nurse. I have a master's degree in nursing, and that degree focuses on people that are living in their home, what we call in the United States ambulatory care. I've been in this space of being a nurse for 35 years. And in that work, I've also organized a book, which you see me in this picture holding, which is called Prepared. And the content of this book is for us all to think about how we prepare for aging and how we prepare to care for our aging parents, family, friends, partners. It was really an honor for me to be a caregiver and to serve the woman on the cover of this book, which was my aunt. She lived with us for 17 years. So I was both a nurse and a caregiver at home. And I realized that there was a lot of challenges in this role. And many times I didn't even take care of myself because I was so pressured by my work, my family, my young children, my aging parents, my spouse, my partner. And there was no time in the day to really even take care of myself. So today I want to talk to you about ways that you can manage both the physical demand as well as what happens in our hearts, in our heads from a psychosocial demand of caregiving. I apologize, I've not placed the camera on because in the Northeast today we have a storm and my Wi-Fi is down, so I'm on a hotspot and the video wouldn't be supported. So you'll just have to imagine my smiling face and my warm eyes as we talk through these concepts, which I believe are really universal across the globe for us as humans in that human condition. When I talk to caregivers, I try to give them my first tip is to think about the choices that you don't have and don't give those choices. And that sounds very restrictive. But what I do tell people is actually work really hard at giving lots and lots of choices to the person you're caring for. And it kind of sounds like a balancing act. But the truth is, there's really some things we shouldn't negotiate. We shouldn't, like I said, as my own example, I failed to take care of myself, even 1 hour a day for exercise. I didn't make this a priority because I was caring for my children, my family, my aunt, my career, my work, the house, the cooking. The days would go by and no exercise for me. So I became very unhealthy. So that was a choice I learned I couldn't give. I could come into the caregiving role, but I had to say right away that I mattered and I needed some time for myself each day, and that my, going for that walk helped to clear my mind, helped to regulate my nervous system, helped to be very good for my body to just move. And that made me a better caregiver. So this was a choice I couldn't give up. Now, there's also examples that really come from medicine. And if you think about whatever medical condition your loved one might have, maybe something simple like diabetes. And we know that people with diabetes need to, take their insulin. Well, that's a choice you don't have. You can't say, we're not going to take the insulin. But you can give lots of choices around where do they want to put the injection. You can give lots of choices around the diet and the menu. And actually, what I say about really empowering your loved one is to let them pick the menu. Let them decide what they want to have for foods that week and contribute to, maybe they go to the grocery store to you or to the market, wherever you go to source your food. They help to decide what you're going to eat and when, and take a lot of fun and creativity. Because as humans, when our choices are limited, we feel very frustrated, and we don't want to go along with limited choices. So even with parenting, you might have a small child and you can't give them the choice, maybe not to go to school, but you can give them the choice of what to wear, what color for the backpack, what color for the lunch, what they want to have in the lunch. Give them lots and lots of choice. That's very empowering and a sense of purpose to our human condition. And these are international themes. It's not just something in the States or something in Canada or China or Japan. As a human being, we really want to have a sense of control over our life, control over our health, and some choice. So give as many choices as you can. And remember, some of those choices aren't important. So maybe my child went to school in clothing that I might not have picked.
Hello.
But yes?
I'm sorry, ma'am. Your slides are not moving, in PPT. You are on the first page.
Okay, let me go back.
Yes.
It says it still has my picture? Are you seeing the slide now?
It will take some time, madam. Still, it is not shared. Yes, ma'am. Now it's visible. Please continue. Yes.
Okay. I apologize. So you didn't see any of the slides? Okay. So this was just a little bit about me and the plan for the day. And as I mentioned, I'm talking about choice. Are you seeing the slide that says matters of choice?
Yes, ma'am. Yes.
Okay, thank you. I apologize. So So the second tip that I give caregivers after about thinking about choice. So the first tip, don't give choices you don't have, but work really, really hard to give lots and lots of choices. The second tip I give is to really identify resources and to do it very early. I think oftentimes we have a mindset that whatever comes with life, we can just handle it. And we're going to just figure it out on our own. This can be very isolating. And caregivers oftentimes feel alone in, caring for their mom or their dad. So think about resources for you. And if you're someone on social media, you'll find that there's lots of groups, of caregiver groups, where you can find peers, where you can find other people who are struggling with the same challenges you are. And that gives you some support, but also finding resources for the person you're caring for. So if that person is new, doesn't understand their diabetes or doesn't understand their heart condition, finding education for them, finding resources for them, looking into either the internet community or your physical community. And again, I know that the resources vary across the globe, but in an idea, sort of from the ideal perspective, we can use the internet to connect ourselves to information and opinion from other parts of the world. But then we can also look locally into our culture and our traditions and our friend group to find other resources. Something as small as having a neighbor that might come by for 1 hour to visit with your loved one that you're caring for while you get that 1 hour that I mentioned to go take your walk. This is a small thing, but it's a really big thing. So think about how to identify resources for you and for the person you're caring for and for everyone in the family. Because when one member of our family has a change in health, maybe a stroke or a fall, it doesn't just affect you, the person who's going to go care for them. It also affects your children and your spouse. And so everyone in that family is going to have some impact. Think of it as like do you know this like a mobile that sort of hangs over a child's bed that has decorations on the top? We have those here in the States. One piece of that system affects every other piece of the system. So my suggestion is to really think about the resources for you and for them. My third tip is to be really careful and thoughtful about the roles that you take on for yourself. So if you're the caregiver, and let's say that it's your partner, your spouse has had a change in health. They've either had a fall, they've had a stroke, they're needing some surgery, they're having a cancer treatment. You have to think about how much energy you have as a human to support them. My advice is to own the strategy, to own the decision making. Go to the meetings with the doctor where you choose for what's the treatment going to be, maybe for the cancer. However, you don't have to drive to every maybe radiation appointment. So those are the kinds of things you could delegate, the execution of the plan. So you've already decided what's the approach going to be for the condition, but now you have to get people to come in and to help with just sort of executing that plan and doing the tactical steps. And as I said, caregivers typically, and this was me as well, we tend to take everything on ourselves. We want to own the strategy. We want to be at the appointments, make the decisions, but we also then want to go to the grocery store, do all the cooking, do all the dishes, do all the cleaning, put the children to bed, read them the story, put the loved one to bed. And then it's late at night and you realize that you haven't any energy left to care for yourself. So we have to think about how many roles we're actually going to be. And, if you step back and you think about your house, your home, there's cooking, there's cleaning, there's laundry, plus someone's working, plus there's interacting with the marketplace, the errands, going in and out of community to pick up supplies that you might need. Then there's interaction with the family, there's communication. When you're caring for someone that's had a change in health, other loved ones want to know how they're doing. And so there's a communication expectation on you as the caregiver. These things take time and energy. And that makes us, we use the expression in the States, burnt out, meaning that the person that's caregiving just has nothing else to give. Their nervous system is completely exhausted. Maybe they're in adrenal fatigue. They've just taken on too many jobs in the family. And so as the caregiver, my advice to you is figure out and own the strategy, delegate as much of the execution. And that means that someone else is helping maybe with the lawn, with the yard, with the cooking, with the picking up of the, decide what you're going to eat, have someone else go to the market. This way you minimize the number of jobs or roles that you're actually trying to do in the course of a day. And remember, no one can take care of you except you. So if you're really thoughtful, you can be where you want to be and part of the conversations that are decision-making and strategic, but then you can delegate those tasks to other people and call the whole family together. Call your friends and neighbors together. I'm guessing, like me, when I have something going on in my family, I have people that offer to assist, and they will say, oh, let me know how I can help. But oftentimes we don't take up the help. Oftentimes we think we have to do it all ourselves. Take up the help. First of all, they want to help. Actually makes them feel better to do something small. And if you're that person and you know someone might need some assistance, here's a strategy. Instead of simply saying, let me know how I can help, try something like this. Would it be helpful if I came over on Friday and I brought the dinner? And oftentimes when people are in crisis and something's happened in the family, there's a sudden change in health, or you're in that chronic caregiver fatigue of just constantly doing the bath and the work and the cooking and the moving, you don't even know what you need. So if you're one of those people who are going to offer help, offer something very specific. Use this sentence, would it be helpful if I, and then something that you know you like to do, that's really something the family needs. Maybe you're going to drive the children to school, or you're going to drive the children to an activity, or you're going to bring the meal, or you're going to pick up the food at the market. Be very specific in your offer. And if you're the person hearing this, just say yes. Allow others to be of assistance. Kind of goes back to the resourcing. Make sure you have resources for yourself and resources for the person you're caring for. And by letting others in and out of your home, you're also helping with what we all experience as we get older, oftentimes is social isolation, where we have just a few limited contacts, maybe the people we live with in our immediate home. And we no longer have community contacts or work vocation type of contacts or religious contacts because our physical abilities has limited where we're able to be. When you bring others into your home, someone's dropping off the groceries or someone's picking up the children, you actually, just a few moments of hello and how are you, a little conversation between the person you're caring for and that other person entering your home, it does a lot to reduce that feeling of social isolation and give them a sense of purpose. My next tip is for those of you who are working outside of the home, maybe you're working from home, but you're working for another organization. Really, we have a tendency through fear to not share with our employer that something's happening at home or that you're in this chronic role of caring for someone. So my tip is to be courageous, be vulnerable, and talk about the kinds of resources and assistance that you might have from what we call in the United States employee assistance programs. But these are really resources, going back to slide 5, these are resources that your company has access to, and they want to help you during these times. Sometimes a you may be a caregiver for just a few weeks to a few months as your loved one gets back on their feet. Sometimes you might be moving into a caregiver role that's going to be, forever. And your loved one is not going to change. And your employer needs to just understand the amount of additional burden and stress you're taking on. And while you adjust to that, you may not be your best at work. But your employer and an organization where you work that is really with you for the long haul, they want you to be a long-term employee and add value to their organization. They understand and they respect that staying with an employee for life means that you're going to go through life and those changes in health happen. So don't be afraid to ask for help. Although I know this is an area that for me, at one time in my career was a struggle, but I'm really pleased to say that, it's really come a long way in the United States, and organizations and the culture within organizations is such that they want to be supportive of their employees as they go through these transitions and help you to figure out what's best for you and for your loved one. Now, my last tip today is to think about how healthcare is going to be paid for. Again, this is a universal concept. We call it different things in the United States than we do in Canada, than we do in India, around the world. But the bottom line is healthcare is expensive and someone has to pay for it. And in your community, there's usually a variety of ways which you can access healthcare and who's paying for that healthcare. So I really encourage every one of us as caregivers to think about right now, how do you find healthcare? Who pays for that? Do you have some, private insurance that you're paying for? And what will they cover when you do take your loved one into a hospital? Or if your loved one needs additional care at home? Is there any benefit for them assisting you with the needs that you have extended for that person while at home? In the United States, this is a complex part of our healthcare system. Our healthcare system, as you know, is really founded on the principles of business, that providers of healthcare would actually make a profit like you would expect in business. And so like someone like myself, who I work with my employer and I have a commercial insurance plan, they are going to pay some of the bill, but not all. And I know, and I've educated myself, what portion of the bill I would pay when I needed to go into a hospital setting and receive care. In the United States, there's extended care beyond the hospital. We don't want people to stay there too long. We want to move them to another setting where their needs can be met, but it's a little lower cost. And so again, you see this internationally, that the balance between being able to access healthcare, access affordable healthcare, that's, finding the balance between what you can afford and high quality is a question that you should ask before you get into a sudden change in health. And so asking yourself right now, how do you find care? How do you seek care? Who pays for it? What portion of that bill might you be responsible for? So that in your money, in your budgeting, you're planning ahead for some changes in health to occur, because as we get older, they do. It's just a human fact that as we get older, we have more opportunity for chronic illness. We have more opportunity for slip and fall or fall and break, chronic disease that becomes an acute problem. And that care of those problems can be expensive. And planning ahead is a way to help reduce that stress for the caregiver. Now, I know we just have a couple of moments left before we come to the end of our time together. I apologize that my slides weren't showing in the beginning. And I did mention that in my 35 years of being a nurse in the United States, I worked in hospital settings, in clinical settings for the first half. And then I had an opportunity to go to work for a technology company that was supporting those hospitals and supporting those communities where our seniors will oftentimes go to live to seek care after the hospital. And the lessons that I learned in that role, I put into this book that I called Prepared. And I shared earlier that this beautiful woman on the front of this book actually lived with me for 17 years. And as her caregiver, who was also raising 3 children, doing my job, trying to maintain my relationship with my partner and my extended family and all the joy of life and traditions and the way we celebrate and our holidays, all of that is very overwhelming to me as her caregiver. And so I just wanted to remind each of you who are stepping into that beautiful role, there's no greater joy in life than being of service to someone else. But I learned a lot of lessons of mistakes that I was making, and I'm sharing those lessons with you today. Now, the reason I placed her on the cover of this book, and this book is really it's tailored to conceptually, it's tailored to concepts that all of us humans face. We have to think about what we want for our own self. And in the event of a sudden change in health, what would happen? Where will you go? What's going to happen when you get there? And this book is really very practical. And in the US market, if you are in the US market or know someone in the US market, this book actually guides you right through our system into our emergency rooms and our hospitals and our extended care and getting back home. But conceptually, the questions that I ask and the things that we think about are really universal. What do you want for yourself in the event that you can't speak or you're incapacitated? And so in every country around the world, we have the opportunity to state these wishes for ourselves in your legal documents and my legal documents. So I just encourage you to think about, as a human, how you've communicated your own needs. And if I can be of any service or assistance to you, you can find me, of course, on LinkedIn. This is how we were sharing this meeting. You can also send me an email with any questions that you have. I am really committed to caregivers worldwide and their needs and the people that they care for, because again, I know from my own personal experience, it's a wonderful role to be in service to someone else, but finding the balance so that we don't drain ourselves and become burnt out as caregivers is essential. So thank you so much for having me here this evening. I appreciate the opportunity to share my thoughts and my heart with all of you.
Thank you so much, ma'am. Thank you so much, ma'am, for the wonderful presentation. The topic was related to our health, and Honorable Cheryl Madam have explained it very well, clearly in simple language. Now I request dear participants, if you have any query, please come with your queries. Dear participants.
Good evening, Dr. Bedkar sir, Principal sir, Prashant sir, and good morning, ma'am. Wonderful presentation you have made. And I think you have talked about healthcare. And plus to that, if we are working and we are devoting and dedicating for such a kind of wonderful services, one should be very capable physically, mentally, and ethically to conduct this kind of services. So I think that is how you have placed this whole topic. So you were talking about your family, you were talking about your own self, and then you have talked about what are the services you can extend. So wonderfully explained, and really, to provide service is a great thing. So usually in India, we are having a public health sector and the government is running this. And there are a lot many schemes are there, where you'll find the people who are socioeconomically not well developed, they are getting free of cost treatment. And I had seen, the grassroots level workers, there are some people who are going at a very grassroots level, house to house in a villages, in a rural and tribal areas. And these people are also doing a wonderful job. These people are also doing a wonderful job, and I think they are having a sense of service. That is the best part of it. So that commercial aspect. Hello, am I audible?
Yes, sir. Yes, please.
So that commercial aspect is not seen, but yes, definitely there is one segment where you'll find only the people who are well-to-do, they can go and they can have access the services. So that disparity is there in between these two groups. That is what we could see in a healthcare system. But I was there for various kinds of disasters management, program. Whenever there is a disaster, post-disaster thing, I used to visit, and I to visit post-disaster like a flood and the earthquake and various places. So yes, definitely what you said very correctly, that your physical abilities, your mental strength, it works a lot in such instances. I've seen places like Kashmir where the flood proportion was there, and then we went over there for 15 days and we were serving over there free of cost, no doubt. And my whole team was working very hard. Then Surat and other places also, earthquake also. So we have served a lot. But yes, definitely to provide health care, to become a caretaker, it requires quite a good amount of strength, mental, physical, social. You should have sociability also to get mixed. And you were talking about how you had taken care of some people. So that is also wonderful. My question is, very important thing is, to find out resources. When we are providing any kind of healthcare or any kind of care, what are the resources available? I found when we went to the real ground, reality is always different. And what we were thinking at, office, it was very different. So how to reduce that gap? The availability, utilization gap is also there. Or sometimes you'll find, the fire is huge. And I was standing, as if with a small bucket of water in front of it. It seems to be like that. So the resources were less and the problem was big. So how to make a study of such a kind of resources? Thank you, ma'am.
Yeah, thank you for your talked about some of the economic, dispersity and some of the inequalities. And we, again, we see that worldwide, here in the States as well, that there's definitely inequities, right? People that can't afford care, that need care. And what are the social systems? What's happening at that local level around resourcing, for those folks? Because what we know is that if they don't get the care that they need, ultimately, it will become either more expensive to give them the care that they need, or it will have a terrible impact on their life, even take their life. So I think you're right that from a resource perspective, and what I love about the internet is that we can see and we can search worldwide, right? We can find both academic research, clinical, like all that information, but also, hey, I could just find a group of caregivers that is willing to let me vent my frustrations, right? Just some of my mental health could be supported. So I think those resources, if you are able to be accessing the internet, are quite endless. But to your point, locally and on the ground, when we are in a community, those resources are quite different. I do encourage, people to do as much as they can. Locations, people that like to go hiking, or a group of people that actually find people with talent in the resource area that you need. And we don't always think of that. We always think I have to go, find a nurse or find a nurse in your reading group, or someone in your gardening club might know someone who has those kinds of skills. And so, trying to use the social networks that you have on the ground are a way to think creatively. And I'll be honest, I think that we are facing a real resource gap. Certainly in the United States, the number of people over age of 65 is 60 million. 60 million. It is a huge number. We need to be there for them, to advocate, to assist them, to help them navigate the healthcare system. And so that's going to put a huge drain on those individuals. And I do worry about that. It's one of the reasons I actually wrote the book that I did, because I tried to pour 35 years of knowledge and tips into a very practical guide that is on the bookcase for anyone to find, for less than what we call a co-payment, less than $25 US, and really gives you a lot of good ideas for how to gather more resources in our country, where we won't have enough assistants, doctors, etc. And the untrained or the unpaid caregiver is becoming a bit of a crisis.
Yeah, thank you very much, ma'am.
Any other questions I can answer for you this morning, this evening?
Ma'am, I want to say something further. I think, we went for Surat, one post-flood area, and we were expecting the diarrheal diseases. And we took many medicines related with the diarrheal diseases. And we found over there more injuries, the pedal injuries because of the mud and the water, pedal injuries, and the dressing material was very less, That is how we realized that, the ground reality becomes a little different, and what we think at office, it is always different. Yes, ma'am. Thank you very much for your explanation, and you are serving for the people. We also work for old age people, and more than healthcare, what they require is a moral support and that love and the affection and compassion. And I think you have done a wonderful job. So all the best, and thank you for your future.
Thank you. Thank you, everyone.
Santosh
Have a good
Gaikwad.
evening.
Just wait, ma'am. Santosh Gaikwad sir have raised his hand. Please, sir.
Am I audible, Todd?
Yes, sir. Yes,
Hello.
please. Ask in short, sir, please.
Okay, yes, sir. Sir, good evening, one and all, and good morning, madam. As you are very devoted healthcare taker in your countries, and your reflection is really insightful for us. Thank you for the organizer and your reflection, ma'am. My question is that, is there any facility in your country for the student who are facing the mental issues in your country? Hello?
Well, from a mental health perspective,
Yes.
I think you mentioned students.
Yeah.
Right? Specific for students. So
Yeah,
I think that the students in the United States are using a variety of resources for mental health between the internet, download the app, and then schedule a meeting with a mental health worker and have a virtual, video call pretty quickly, which has been really good, because getting an office appointment, an in-person appointment with a mental health worker, can be a long wait. Because they're just so booked out 4 or 5 weeks to months. And so some of the apps that I think younger students are taking advantage of. One thing I will say in the States is that, the COVID pandemic really helped us to take the mystique, the negative image that mental health had, And it's become more open, and people are talking more, just as important in the same way that we need to do for our mental health, and that it's mental training, not just thinking about the health. So that some anxiety or depression or exhaustion, overwhelm has been really openly talked about. And I think that that's been helpful for students, but there's still I think still people have a sense of shame if they feel that they need to, to talk with someone. And yet we really need to change that paradigm, and people need to really talk as much about their mental health as we do our physical health, and recognize there's daily work that needs to be done for our mind and our health as well. And that our younger students age, university age students, or now just early adults, they were using more apps than they were using actual appointments for mental health challenges.
Thank you very much for your information, ma'am. Thank you very much.
Thank you, ma'am. Thank you, Bedkar sir.
My pleasure. Thank you very much for having me. Bye-bye, everyone.